Good afternoon, and welcome to today's Michigan Medicine Well-Aware presentation. I'm Kelly Malcolm, and I'm the lead research communicator for the Michigan Medicine Department of Communication and a frequent Well-Aware moderator. Today, I'm going to be asking all of our experts to join me for an entire hour of a panel discussion regarding what to do as the U.S. loosens the public health guidelines that were designed to slow the spread of COVID-19, particularly in light of new CDC mask guidelines and vaccinations being made available to teens. Topics and questions asked today may include, but are not limited to, vacation with another family, sending your children to an indoor day camp, swimming lessons, cookouts, parades, herd immunity, and what to do if you're vaccinated but your kids are not. We will begin with those who submitted questions in advance and then get to our live audience who are joining us through Zoom. To submit a question at any time, please use the Q&A feature at the bottom of your screen. We'll do our best to get to as many as possible today. So joining me are Dr. Preeti Malani, Professor of Internal Medicine and Chief Health Officer of U of M and the Director of the National Poll on Healthy Aging, Dr. Jill Noble, Assistant Professor of Pediatrics and Interim Director of the Division of General Pediatrics, and Dr. Pamela Rockwell, Associate Professor of Family Medicine and Medical Director of Family Medicine at Domino's Farm. Please join me on the stage. And I'd like to note that at this time, we can't have the presenters provide personal patient recommendations, but we can give general advice. Okay, so I think we're going to get started and jump into our questions. Our first question, what is the current understanding of transmission rates between vaccinated adults who are no longer wearing masks but maybe asymptomatic carriers to unvaccinated children? This is a big question. Dr. Malani, you want to take that?
Yeah, sure, Kelly, and thank you for the question. This is really a good question. And, early on, there was a lot of focus on, even after vaccination became available, that we weren't sure if being vaccinated meant that you couldn't get infected. And if you got infected, would you have symptoms? Could you still spread? And, this is a big discussion, and it's just, I think it underscores one of the things that's difficult about COVID is that the science changes and evolves, and we learn new things. And again, here, this is a place where we have a better understanding now. And what I would say is that that based on the latest guidance, is that if you are vaccinated, first of all, your risk of getting infected, it's not zero, but it's pretty darn low. And if you looked at data from earlier this month or last month from the CDC, out of 100 million people who were vaccinated, there were about 10,000 breakthrough cases. Now, not every case was necessarily caught or documented. And among that group, about 1,000 people got hospitalized and about 100 people ended up dying. And these were by and large older people. So back to the question is that it seems that if you are fully vaccinated, that your risk of getting infected is very low. And frankly, it's even lower now because numbers, at least in the United States, have come down so much. And that if you do get infected, it tends to be mild and that you are unlikely to spread. So lots of little caveats in there. But I would say at this point, the science says that that this is why you don't need to wear a mask. And so I would say good news, and that the risk is minuscule, especially at this point with rates coming down so much in the community. Sorry for the long response there.
No, that was great. That was very thorough. Does anyone have anything else to add? I know a lot of people are worried about this.
Well, yes, because I get asked this question quite a bit. And so with every month of the pandemic, more evidence comes out because research is ongoing and we can't predict the future. But what the research is showing is that if you're fully vaccinated, your risk of getting an infection, not having symptoms because you're vaccinated, and then transmitting that infection to somebody else is actually less likely than was previously thought possible. So all good news, but I don't have hard data to support that. I feel comfortable, say, being unmasked because I'm fully vaccinated around people in my personal life, even who may be immunocompromised or a family member with Down syndrome, say. So I feel very good about that, that the evidence is getting more positive, that we cannot transmit the infection once vaccinated. Nothing is absolute medicine. We never say always and we never say never, but it's looking more and more positive in that way.
Okay, that's excellent news. Okay, so our next question, what precautions should fully vaccinated people take when going to crowded outdoor activities this summer, like sporting events, barbecues, or carnivals? Dr. Rockwell, you want to take one?
Yes, I think this has to be an individual approach. In general, CDC says if you are fully vaccinated, you do not have to wear masks, especially outdoors where it is more difficult to even acquire the virus if somebody has an infection. However, look at your own personal background, and maybe you received the vaccination, you were under some immunosuppressant drugs or chemotherapy time. So we don't know for sure how well the vaccine took. So I never go out without a mask, have a stash in my car, have some in my purse, just in case I need to go in. And as a physician, I do want to be responsible to my patients who may be immunocompromised. So I do wear a mask still when I go into grocery stores or I go out shopping, but that is a personal decision. But let's say going to an outdoor event, carnival's interesting. Now, if you were stuck on a ride sitting with one other person you never met and you don't know if they're vaccinated, I would put my mask on just to be sure, because it would give me peace of mind. But technically, you can feel safe going out without a mask when you're going to a ball game, say, or going to a soccer game with one of your children.
Okay. Let's do our next question. What are the vaccine and mask recommendations for organ transplant patients? Are there antibody tests that can determine how much protection they have from the vaccine? Dr. Malani, can you take that one?
Yeah, I'm happy to take that. And this is a really important question, and it's one that we are getting. I'm an infectious disease physician, and I actually just talked to our director of transplant infectious disease about this question, just to make sure that things aren't changing. And I would just say, first of all, this is a very diverse group clinically. It could include somebody who had a liver transplant 10 years ago and is on very little immunosuppression, and it could include someone who was just transplanted and issues with rejection. So there's a wide range in terms of how immunosuppressed people are, but this is a group that we continue to worry about. And my advice always is to talk to your doctor or whoever takes care of you to really think about how you can limit your risk in this regard. And in almost every case, people should get vaccinated. What we're thinking about is trying to be upstream on this issue, so people who are waiting for transplant are getting vaccinated, so hopefully they'll have a good response. And one thing I would say is that we really can't tell, like the things that we can measure in terms of a response to vaccines isn't everything. Like we can only measure certain things. And so if anything, the response may be better than what we think. I do feel it's very important that anyone in your household who can be vaccinated, who's eligible, that they be vaccinated. And again, there may be individuals like children who can't be yet, but and I will also add that there are ongoing studies about adding another dose, different schedules, different dosing. And so we may learn more in this. The role for antibody testing, routine testing, is not there. We are not doing antibody testing. Frankly, I think it just creates confusion and it creates stress for people. There are some special circumstances in which people might look at T-cell immunity, but this is not done widely. So I would just advise against it. And again, focusing on that overall risk mitigation. And I will say, COVID is one of many risks for someone who's had an organ transplant. And we worry about other things. We worry about flu. We worry about some less common infections. So talk to whoever takes care of you about your risk and how to manage that.
Okay, fantastic. Thank you. So our next question, you mentioned kids. My 12-year-old will be fully vaccinated this summer, but many of their friends will likely not be. Do they need to take any precautions to see their friends, or can they see them en masse, spend time inside, do sleepovers, etc.? Dr. Noble?
Sure. First of all, let me say thank you for making the decision to vaccinate your 12-year-old. That was a great idea, and we were all for that. The great news is your child is vaccinated and they can have a normal summer without a mask. So hooray, let's try to get everybody vaccinated as soon as we can. If you are the one that's hosting a sleepover and the children that are coming, you're not certain whether they're going to be vaccinated or not, I think keeping the party outdoors, keeping it small, only maybe another child or two would be very prudent. If you have family members that are medically fragile, you might want to consider only an outdoor event and not allowing them indoors. But for your child who is vaccinated, they can go without their mask to a friend's house and be a normal kid again.
That's incredible. Okay, good news. So our next question, what recommendations do you have for those who have put off their primary care visits during the pandemic and want to schedule them for this summer? Anyone want to jump in with that one?
I can take that one because I also sit on the Michigan Department of Health and Human Services Immunization Committee, and there is great concern here in Michigan as well as nationally that the routine vaccination rates for children, adolescents, and adults have gone down over the pandemic year. Many reasons, all understandable. Many of us, well, first of all, everything was shut down for months, and then people were hesitant to go to the doctor with due cause. But now that things are opening up, I want to make a strong urge to really look at preventive routine vaccine recommendations for children. If our, say, MMR rates continue to stay as low as they are, we are at risk for a measles outbreak here in the state and around the country. For the adults, parents of these children, you may be behind on vaccines and other preventive measures like just routine cancer screens like mammograms, pap smears, colon cancer screening. So I highly urge you to call your primary care physician and get something scheduled. Now, at least at our office, some appointments are very difficult to get. We are still practicing social distancing. We still have physicians doing some virtual care, some doing in-person care. So these appointments are difficult to come by, and we are in catch-up mode right now. And normally when I go in for a day of patient care, I might have 2 or 3 health maintenance exams with PAPs or well child exams. And now my schedule is almost fully booked with these folks trying to catch up. So take advantage of your nurses, your medical assistants, because we are offering appointments that don't need to be a physician appointment, but then you can still get all your vaccines updated or get your screening tests ordered, signed, and then you can make those appointments to have them done.
For pediatrics, last school year, children did not need a new physical to participate in sports. This year, everyone in 7th grade through the end of high school will need an updated physical. So I strongly recommend to families with athletes to call today to get on the books, because the appointments are getting filled up really quickly. And Dr. Rockwell is right. We deferred so much well care in the last year because we were really focusing on keeping well people well. But now it's time to get back to normal, and everybody needs to get their well visits caught up, vaccines caught up. If you're not sure, call your doctor's office and talk with the staff there to find out, what does my child need? When was the last time they were seen? Because we continue to have good infection control practices at all of our offices. We continue to be safe and open and ready to see your kids.
Yeah, I just add like a personal note. I'm one of the people who had fallen behind on my primary care. Gee, I've been a little bit busy with the pandemic, but I will just say, like, vaccinations. Like, for example, I needed to get a shingles vaccine. I didn't, and you can also get it outside of your doctor's office. There's a lot of pharmacies that can help with that, and just same thing with cancer screenings, and use the portal if you're a Michigan medicine patient. And I think the primary care teams have been working overtime to try and be flexible and try to accommodate people. And you know what? Make that appointment for next year now is what I would say too.
Yes, good idea. Okay, our next question. Should we continue wearing masks indoors if the vaccination rate is less than 70%? And I feel like that's the case in most places. Dr. Malani, do you want to take that?
Yeah, I'm happy to take that. And, I'm reflecting on Dr. Rockwell's comments too about, just this idea of courtesy and, really thinking about your audience. I will say the science supports not wearing masks indoors. And all of this is in the background, not just of like how many, what percentage of the community is vaccinated, although we're right at about 60%. We're going to hit 60% probably today in Michigan. I know our viewers are from all over, but we also are really seeing the rates of infection come down a lot. We're down to a few hundred cases a day in Michigan, and it's likely that they're going to stay low, at least for the time being. And so, I think keeping that in mind, and, personally, what I'm starting to do when I'm out and about, like grocery shopping and things is not masking. But, sometimes when I get in line, I'll put it on. And part of it is that we're trying to figure out the social cues on this. Outdoors, I feel very good. Indoors, this is changing, and we're going to get more guidance, particularly classrooms. Michigan State yesterday put out a statement about if you're vaccinated, you don't need to mask. Now, healthcare setting is very different. Certain settings where there's vulnerable people is different, but we do need to start thinking about what life might be in the next phase for people who are a little bit nervous. And again, I think take your time, get comfortable with this, but also look at the science. We've now loosened up masking rules for about a month, and we're not seeing an increase in cases. And to me, that's very important.
Yeah, really good point. Okay, I just want to remind the audience, if you have a question, please use the Q&A function and submit. Hopefully we will get to all of them. Okay, our next question. How do you recommend that families mix when they have young unvaccinated children and vaccinated older children and adults, and getting together indoors and outdoors? I touched on this again, but maybe we could restate. Is it okay to just kind of those groups of people?
I'm going to let Jill comment, or Dr. Noble comment after I say a few words. I have a niece who has Down syndrome. Yes, she's been vaccinated. She's 15 now, but I think it's common courtesy, like Dr. Malani said, if you see others and you don't know everybody's health history, and if you're in a situation indoors, say at a Girl Scout meeting or something like that, it would make sense to me to continue the masking indoors, because there may be many children who aren't vaccinated, who are under 12. And so I still recommend that. But if you're in your own pod or your own group of friends in the neighborhood or family members who you've sort of stuck together through this, and the majority of people are vaccinated, I think it's a judgment call for parents. But it's very rare for kids to have a severe disease, but it's not impossible. And so it is concerning to use your own judgment there. And I'll turn it over to Dr. Noble, who sees only children in her practice.
Sure, but I agree 100%. I think that if you're in your pod and you are not mixing with 15 different families, I think being a little lenient on masking unvaccinated children is probably okay. If you routinely meet up with multiple families and they're not vaccinated, your children are not vaccinated, I think you're going to want to be careful with your under 12-year-olds to make sure that they're safe, and really encouraging them to wear their mask. I think the schools will continue to mask for a while, and I think working with your children so that they understand to be respectful of whomever's house they're at, to follow the recommendations or the request of those families. So it's just being a polite neighbor.
Yeah, right. I might just chime in. I actually don't see children medically. I see them at home, in my own home, although my kids are a little bit older now. But, I would just say with families, it's complicated, and families disagree on these issues sometimes. And what I would say is, if you're having an event, is be outside, take advantage, or open up the windows. And again, like with you can control what you do maybe with your own children, and you can do your best to model good behavior. And I also would say to have a conversation, even if it feels a little awkward. What I said a lot last year before vaccinations was keep your groups small, be outside, keep your groups consistent. And I talked a lot about shared risks, shared responsibility. But I think this is really important, especially as families are finally getting a chance to get together. And, if everyone is being smart about things, that residual risk is manageable. And it is also a risk to not get together because, boy, the world can change and you lose these opportunities. So again, have a good conversation. If you're concerned, try to plan outdoor activities as much as possible.
Great, thank you so much. So speaking of getting together and maybe traveling, this question is, going forward, will there be data available to identify specific COVID infection hotspots so they can be avoided even if vaccinated? Dr. Rockwell, you want to take that?
Yeah, actually, the data is available now. If both the CDC for national data and then MDHHS, Michigan Department of Health and Human Services, have websites that are updated regularly and show you where these hots and high rates of transmission are. Like right now in Michigan, there is one county that is higher than the rest. I believe it's Macomb, but might be Oakland. And you can see these maps and just update if you're planning a trip going somewhere. I mean, even the UP has different levels of rates of COVID disease right now. So depending on where you're going, I would advise looking ahead because you just want to be prepared for what you're going to do for indoor dining versus outdoor dining or activities that might involve other people around.
Right. Okay.
Kelly,
yeah.
can I add one comment to that? We think a lot about COVID as the big risk when there's COVID in a community, and there are like little blips. And frankly, in some of the less populated counties, it could be a small outbreak, like from one party, that could really drive those numbers. So I think you do need to pay attention to denominators. But one thing that I would caution is that frankly, the United States overall is doing really well, thank goodness. But especially as people are starting to think about international travel, and a lot of people have asked about Europe. And one of the things that maybe we don't think about is that if you have another health issue that requires you to seek care, it may be very complicated if a place is having a surge of COVID cases. Even if you're vaccinated, you're not concerned about COVID, you could break your leg, you could have a cardiac issue, you could have other things. So I just think in general, it's harder to go into a region where there's a concern about a surge because all the health infrastructure can be stressed.
Okay, fantastic. So this next one, I'm actually interested in this. I have a 2-year-old. Should younger unvaccinated children continue to wear masks? And if so, when? And what, if any, activities or environments should they avoid? Dr. Noble, you want to take that?
Absolutely. So for children under 2, we don't recommend masks. So that is unchanged. For those unvaccinated children from 2 to 11 years and 11 months old, if they're going to be in large settings with lots of people where you don't know anyone's vaccination status, we're still going to recommend that they wear masks. Certainly if they're indoors in large group settings, then masking would be a great idea. If it is, you're going to go to a neighbor's house and that neighbor is your pod and everyone is vaccinated, then that child could go without a mask. Again, making sure that the parents agree and everyone around them is comfortable. So I think the masking recommendations for this age group hasn't changed much, and to continue to do our best to keep them in masks, along with good hand washing and all those other infection control things that we've worked on so hard these last little bit more than a year.
Okay, so switching gears a little bit for our next question. More and more people are saying they had a negative rapid COVID test. Has rapid testing for COVID improved? And would you still recommend a PCR test if your rapid test was negative? Dr. Malani, do you want to take that?
Yeah, so, COVID testing has evolved so much. I think about last spring And again, I'm an infectious disease doctor at Michigan Medicine. We couldn't actually even get testing done on patients who we were pretty certain had COVID. And now you can go to your drugstore and buy a test. And it's like a, little kit, and you can do these tests. And a lot of the rapid tests are antigen tests. So it's a different type of test. And if you have symptoms, they're pretty good. They're not perfect. There are going to be some that are going to be false negatives, and there'll be some that will say have a positive test when you don't have infection. And so I think, again, thinking about where this is useful, and we're still trying to understand that. The place that I've heard people using it is if they have children with the sniffles who aren't vaccinated, to sort of see if their test is positive, or if they're going to gather their whole family together and they want everyone to just test before they bring the group together. And I think, frankly, we're seeing a little bit less of that now that vaccination has become so widespread and so available, at least in the United States. So what I would say is, I would ask why you're being tested. If you're having symptoms and you're unvaccinated, by all means, you probably need a repeat test, and it will likely be a PCR test if you go into the healthcare setting. If you're just testing because it's just something that you've decided to do, or you're unvaccinated and you don't have symptoms, it's probably not going to be useful. Some places are still requiring testing, some travel locations, some summer camps. So there may be reasons to get tested. I just want to make a plug, and we'll share this link in the chat. Washtenaw County Health Department, the CDC, NIH, they just announced this a couple of days ago. They're collaborating around this home testing initiative, and this is going to be free, rapid, in-home testing for people living in Ann Arbor and Ipsy. And there's a phone number, and you can pick up these kits. And the idea with this is we want families to do this twice a week to protect their family and their household, their community. And part of it is to understand really the role of home testing. A few months ago, we thought, well, maybe last year, before the vaccines became available, and when we weren't really sure what was going to happen in terms of the vaccine timeline, one of the thoughts is maybe home testing is going to be something you do every morning. You'll just test yourself before you go to work or before you go to school. And fortunately, we got to a different place because of vaccination. But I'm still trying to understand, and I'm sorry, I'm going on and on, but I'm still trying to understand exactly where home testing has a role. And I would caution that it's not perfect, and it may not be necessary in everyone, but it is there and it's available, and it is being used.
Okay, so our next question, if you've already had COVID-19, should you still get the vaccine?
Yes. Yes. So what we do know as time goes on is how effective these vaccines are, and they are. What we don't know is how long the natural immunity from a natural COVID infection lasts. And the recommendation from CDC is, if you've had an infection, get vaccinated. And it looks like, these people may be more immune than the rest of us who only got vaccinated, as it turns out. Time will tell with data. The only caveat to that is if you did get COVID and then you receive therapeutics like monoclonal antibodies, you should wait 90 days before you get vaccinated. But the recommendation is still to get vaccinated.
Yeah, I just want to add, Kelly, it's interesting because, there are data that show that after one dose of like a 2-dose regimen, if the mRNA vaccines, that your response after you've had COVID infection is similar to someone who gets 2 doses. And there's a lot of discussion on this, but the CDC guidance is what we go by in terms of determining whether someone's fully vaccinated. And, this question is getting asked a lot, on campus and in schools and other places where there's a strong recommendation or even a requirement around COVID vaccination. But this doesn't mean that in 6 months, the recommendation might not be different. But, my sense is that this is where we're going to stay because we just still don't understand immunity fully, both like after having infection, as well as the duration of immunity after being vaccinated. But I think this is one of those myths, or I don't know, beliefs that's out there, but you still do need two doses to be considered fully vaccinated.
Right. Okay. So Dr. Rockwell, I know you mentioned the 90 days for monoclonal antibodies. Is there a waiting period for someone else who's had COVID before they can get the vaccine?
I mean, historically, we told people, why don't you wait 90 days because we didn't have enough vaccine and let's get everybody else vaccinated and sort of pool our supply. But now the supply is not an issue. So you can get vaccinated after having infection and recovering from your infection.
Okay, great. So our next question was touched on earlier, but maybe we want to reword it. Can I get an antibody test rather than getting a vaccine if I think I previously had COVID-19?
I'm
Dr.
happy.
Milani already answered that. Yeah. Go
Yeah,
ahead.
you know,
Yeah.
the role of antibody testing is very limited. There are places that will do this to you. You know, they'll do an antibody test, but I don't think you can make any determination clinically. You know, and last summer, you know, I was someone who got an antibody test because I thought, well, gee, you know, early on we weren't masking. I was seeing patients. Maybe I got COVID, and you know, I was negative, and you know, I don't know what that meant in retrospect, you know, other than I probably hadn't been exposed because the level was pretty low at that point before we started doing things. So anyway, there's not a big role for this. And what I see is patients who are getting tested over and over, really concerned that they might have had COVID and that it is explaining certain symptoms they have. And I would just say, please see your primary care provider, see your doctor, because it might be that you're having something else that requires a different type of workup and maybe different kind of treatment. But I know that there are urgent cares and other places that are doing these tests, but I don't know what to make of the results. And it's certainly not a reason to not get vaccinated.
Right. Okay. So our next question, what should I do to keep my kids safe at summer camp or overnight camps?
I'll take that one. So know that the CDC has a very detailed recommendation on how camps should be handling themselves this summer for both vaccinated and unvaccinated camp participants. I think as a parent thinking about sending your child off to camp, if they have the opportunity to get vaccinated, get it done before they leave. If they are not old enough to be vaccinated, then expect that they will need to be in masks. And I absolutely would encourage you to ensure your children are wearing their masks correctly and that they're really doing an impeccable job of good hand washing and being, you know, careful after toileting and washing their hands before eating, because those kind of things are going to keep you healthy.
Okay. Anyone else want to add to that?
Yeah, you know, COVID's not the only thing you can get at camp. Like you worry about lice and you worry about other things, you know, like, and maybe part of that is just, you know, getting lice at camp is part of, you know, being, it's part of the experience. But, you know, the hand washing, again, not because COVID is spreading from surfaces, but because, you know, diarrheal illnesses can spread from surfaces. And, you know, make sure your kids are otherwise fully vaccinated too. I mean, we touched on this, but, you know, I worry just as much about some of these other vaccine preventable illnesses spreading in camp. And the good thing is camp is about being outside for the most part.
Okay, thank you. So our next question, do comorbidities like hypertension reduce the effectiveness of vaccines, especially with the variants? So who wants to try
That's
that
a great question. As far as research is showing, no, people are still getting an adequate response despite comorbidities. So that's good to know, because folks with these chronic health problems are more at risk for severe disease. So all the more reason to be vaccinated. So I have so many patients concerned because they have certain medical problems that they're afraid of the side effects of the vaccine. So they're postponing getting vaccinated. And I try to explain, they're the ones at risk to get that really severe disease you read about in the paper, you see on the news, and I see in the hospital. So if you have these conditions like diabetes, morbid obesity, things like that, please get vaccinated. It will take as well with you as with anyone else, and it will prevent you from the potential of very severe disease.
I'll just add that the studies done with the vaccine, the investigators are really thoughtful about this, that they vaccinated people in the studies who were at the upper limit of, age 80s, 90s, and even beyond. Many who had health conditions, because again, it was a representative population. They tried to be very diverse and inclusive of who was in these studies. And, again, all you have to do is look at the epidemiologic curves. And the fact is that even before our community vaccination rates started increasing, when we had the most recent surge in Michigan, we weren't seeing as many cases in older adults because they had been vaccinated first. And so I think that shows that even when there was a lot of COVID in the community and young adults and teenagers were getting infected, their parents and grandparents weren't.
Okay, excellent. So our next question, with restaurants opening up again, how safe is it eating inside when you are vaccinated?
I think it is safe to eat inside if you're vaccinated. That's along the CDC guidelines. If you're somebody who just had your organ transplanted and you're on immunosuppressant drugs and you're vaccinated, then I would advise you to go ahead and wear a mask and maybe choose an outdoor dining restaurant. But those are not the majority of people. I think it is safe to now go eat in restaurants if you're vaccinated.
Okay, how about traveling in a car? What precautions, if any, do you need to take? I'm assuming traveling with other people.
And I'm assuming that means vaccinated and unvaccinated. I mean, weather permitting, if you open your windows, that makes a big difference for air circulation if you're with people who are not vaccinated. But I think if you're all unvaccinated riding in a car, A, I don't advise it, but B, I would say drive with the car windows open to reduce any risk of somebody transmitting within that vehicle to somebody else.
And I think if you make stops along the way on your car trip, that everyone needs to either wash their hands or hand sanitize the minute they get back in the car.
And again, when you're in a car, you're usually with your household or with like your pod. You're usually not in shared too much. I mean, maybe with a taxi. And again, if it's a short ride, you could mask and open the window. And in public transportation, the recommendation at this point in the United States is still for people to wear masks. And there's an important reason for that, because that's a big group that you don't really fully understand. But for example, the buses on our campus, this was a big discussion, like, how are we going to get people back and forth? And, you crack the windows, put on a mask, that setting has been shown to be safe as well. But again, if you're vaccinated, you are very safe in all these settings.
Okay, excellent. So this is a good one. What information should I convey to my spouse or others who are resistant to getting a vaccine?
Who wants to take that? I can start. I have many patients who have family members who are resistant, or I have a few patients who themselves are resistant. A few of them have contracted COVID and gotten pretty ill and sort of regret their decision not to vaccinate. But for those who are vaccinated with family members, it's not worth severing all your ties with your family members. But I think trying to educate and redirect where information is obtained, because I find a lot of the people resistant have sort of false notions about the vaccine. And partly it's because there are some sources of information that are putting out bad information. So I trust the CDC and what they say, and they have excellent websites to look at. But you can also just ask your family physician, your pediatrician, your internist about what they think. But it's about educating yourself, and not just if Facebook is your main source of news, look to more sort of mainstream news sources. Nobody has any agenda to vaccinate more people other than getting our society back to order, ending the pandemic, and ending the death caused by this vaccine preventable disease.
I might just add a couple of things to that. And, I know that Dr. Rockwell has these discussions every day, and probably Dr. Noble is starting to have them too, with more kids being eligible for vaccination. One of the things we talked about a lot when vaccines first became available was that vaccination isn't just to protect you, it's to protect everyone around you. And I do think that that's an important piece that's we're not talking about as much because we're seeing just how much vaccination protects us individually. The fact that, you can go without a mask and things like that. But the other piece is that people can move from being hesitant to being acceptable, to acceptance. And it is a long discussion. And one of the things that's been shown in surveys is that that having a conversation with your own doctor is actually one of the most useful things that people can do. So what I recommend too is that, again, in addition to, go get good information, but have that conversation with your own doctor or another healthcare professional that you trust, questions answered. The other thing is sometimes it's logistics for people. I don't think that that's what the spirit of this question is, but I think thinking about the reasons why people haven't gotten vaccinated, some of them it's just been complicated or they've been busy with work. So, offering to be helpful if it means, getting someone a ride or, helping take care of their kids or something so they can get vaccinated.
Right. That's a really good point. Okay, let's see. Next week, we need to have someone come into our house to fix a problem. I am vaccinated and he is not vaccinated. I will make him wear a mask when he comes into the house, but should I also wear a mask? So there's a lot of weird social situations coming up now, I think, with vaccination masks.
I think the CDC recommendation is that no, you don't need to because you're vaccinated. I started a bath remodel 2 weeks ago and was in that situation. Electricians, plumbers, all but one were vaccinated. So I kindly said, you need to consider getting vaccinated. But I didn't wear my mask, but he wore his mask the whole time he was in my home.
Okay. Our next question. How about children under 5? How vulnerable are they to COVID-19 at this point? And when do you expect vaccines to be approved for this age group?
I'll take at least the first part of that. For children under 5, during the height of the pandemic, the children, for the most part, were spared the worst of the disease. They were not 100% spared, but they weren't the ones who were getting sick, and not nearly as many died from this virus. So we know that they do relatively well with this illness. So it's still possible to get it. I still think you need to be careful, but kids do really well with being sick. From a vaccine standpoint, maybe Dr. Milani knows more, but I know that they've started the trials in children who are younger, but I'm not sure of when that's going to be available.
Yeah, I'm not sure either. I don't think it's going to be before the start of school in the fall. It might be just before that, or it might be later in the year. It's not imminent, is what I would say.
But the good news is that children, they are used to getting vaccines. They do very well with vaccines. I think that we will, once the testing is done in all the appropriate trials, we're going to find that this vaccination is safe in this age group. We just have to show that it is.
Right. And I can say that there are trials ongoing right now with children under 12. And it's looking like if everything progresses and continues to go well, it may be about September where an EUA may be applied for, which is the emergency use authorization to give this vaccine. So that's sort of the trend of what's going on now, and hopefully that will happen.
Okay, I'm crossing my fingers. So our next question. So I think what this is saying, if infected after vaccination, so say I still managed to get COVID after I've been vaccinated with maybe a mild or asymptomatic case, do I need to worry about long-term effects from that infection?
I would just say, I don't think we know fully. These are really small numbers. And again, that MMWR from the CDC, their morbidity, mortality publication, and this just came out a couple of weeks ago, and they had 100 million people. There were 10,000 cases. Of that, 1,000 were hospitalized, and of that, 100 died. The average age was close to 80. in terms of the kind of symptoms that we think about, these prolonged symptoms, this post-acute COVID, we just don't fully understand this. I think I have reason to believe that you probably would do better and that you would recover quicker, but there is some residual risk. It's just low. It is certainly much higher to get infected and to have symptoms if you are not vaccinated.
Right.
But one of the unknowns still.
Right. Okay. Our next question. We are planning a summer road trip out west. Everyone's been vaccinated except a 12-year-old. Are there any suggestions about staying at hotels or eating at restaurants and that sort of thing?
Well, get the 12-year-old vaccinated as soon as you can. For anyone who's traveling and is unvaccinated, I think, you should be wearing your mask and making sure you're washing your hands and everything else that we've already spoken of. I think you should go on your trip. You just have to be careful.
Okay. So our next question, what do we know about the duration of the vaccine's protection? Will a booster be recommended? And are some vaccines known to have different longevity of protection than others? Big question. Anyone want to try?
Yeah, I can weigh in a little bit.
Okay.
We sort of lose sight of the fact that COVID is caused by a novel virus, and that these vaccines are also new. And so we don't know right now how long protection is going to last. And to be honest, so far the news is encouraging, and we can't measure all types of immunity, but the ones that we can measure, at least at 6 months, it looked very good overall, and that things could remain protective for much longer. And there are aspects of the immunity that we can't measure. And what we'll have to see is if we start seeing increases in infections among people who are fully vaccinated, several months from now, for example. And, the need and timing for COVID boosters is not known at this point. There's not a recommendation for a booster. There's a lot of discussion around this. And I would say there are two things that might happen. One is that protection could decline over time. And this could be months, it could be years. And, I think there's reason to be optimistic, but we just can't measure all types of immunity. The other issue is the emergence of a variant that would be less susceptible to the currently available vaccines. And, again, so far it's been pretty good news. B.1.1.7 is the one that's predominant in the US, and against severe illness, hospitalizations, death, the vaccine looks very, very good. And it, again, we'll just have to see. So far, things have been encouraging in that the illness that people are seeing, and now a lot of talk about the Delta variant, is by and large in young people who are not vaccinated. So good news. And what I would just say is that in the meantime, go live your life, go do as much as you can, this like amazing gift we have in the vaccines, and that if we need a booster, we'll get a booster.
Okay, good advice for everyone. So our next question, my dad is 85 and fully vaccinated. Can he swim in an indoor pool like the NCRB pool? He loved swimming.
Yes, he can swim. Yes.
Okay.
I'd go farther and say I encourage him to swim, because at 85, frankly, your risk of frailty and falling because you're becoming debilitated is much higher than that tiny residual risk of COVID.
Okay. Great. So next question. If a pregnant woman gets vaccinated and breastfeeds, how well and how long is her newborn protected? Who wants to try that one?
So I don't think we know is probably the answer. The innate immunity that babies can get from their mom can last up to 6 months, but that doesn't mean it does. And I don't think we have any data to know what's going on with COVID specifically.
Okay.
Anytime you have a newborn around, you want to be careful about things. And you don't want people who are sick, and you just don't need a lot of people, frankly, like in and out of your household, when particularly like in that early neonatal period. But the data on pregnancy and with both safety as well as protection have been really good. And there's a suggestion that the infants are protected at least for some period of time. So it's all good news. It's another reason why vaccination is important in pregnancy and anyone who's thinking about getting pregnant.
Okay, great. So I think we're actually at our last question. What do we know about the relationship between mild or asymptomatic infections and long COVID? And if you have any last comments for our audience, also feel free to throw those out.
Again, anecdotes. There are people who have mild infections who end up with these prolonged symptoms. And it's very difficult because we don't understand the biology, we don't understand the clinical course. And people are left really debilitated. Sometimes they can't function that well. They have trouble doing their day-to-day activities. And there is a clinic at Michigan Medicine, and I think we can share some of that information in the chat. I'm not part of the clinic, but I know some of my colleagues are starting to see patients to try and at least help with symptom management and try to understand things. But the severity of infection has not always been linked to that. And my last comments are just like, wow, this is such a different situation than we were even a few months ago. And what I would encourage people to do is really try to find ways to link and be social and move on and maybe visit family that you've delayed seeing. The vaccines have been beyond what anyone expected them to be. Certainly we would have accepted a lot less and been very, very happy, but safe, highly effective. And the numbers in Michigan they've just dropped from out of control to like nothing. And that just makes me so happy. So I really hope people have a good summer and really get back to doing all the things that we've missed doing.
I couldn't agree more. Absolutely.
Yeah, and for those unvaccinated and still wavering, I even though you may be healthy and have no chronic disease and you take vitamins, that doesn't mean you may not get a severe case of COVID or this long haul syndrome, because it's an indiscriminate virus we don't understand well enough. We don't know why certain people or children get severely ill. There's something about this virus we yet don't understand because we never heard of it before 15, 16 months ago. Right. So reservations about side effects to vaccines need to be weighed in what your risk is and what the potential is, even though it's small, to a severe case, or how you might be a vector to give that severe case to somebody else around you who you don't know their vaccination status or their health status. So all in all, I'm just so happy to get more sort of normal, like Dr. Milani said, in our life. But also, we can't forget that the pandemic is still going on and other parts of the world are suffering so greatly right now. And until the entire world's population level of infection goes down, our lives will never be allowed to be normal with travel back or without that risk of somebody coming in from another country who doesn't even know they have maybe a new variant, because their symptoms haven't started yet and they start the day they land. So this is a pandemic and this is serious and this is real, and vaccination is our ticket towards a more normal life and getting this pandemic down. Smallpox is no longer in existence on the earth because of vaccines. And if we didn't have a smallpox vaccine, we would be worried about getting smallpox from each other's neighbor at all times, because it's also a highly infectious agent. So we just need to get vaccinated.
Right. Great. Thank you all so much. And thanks to our viewers for your excellent questions. Don't miss your shots. It's really important to get vaccinated. So before we conclude today's webinar, I'd like to welcome Emily Godbold, Assistant for Michigan Medicine Development.
Thank you, Kelly. And thank you to all of our panelists for offering your valuable time and expertise this afternoon. I also want to thank all of our attendees for your engagement, interest, and your questions. We hope you found this session informative and that you learned some things that might be applicable to your lives. My sincere thanks as well to our wonderful donor community who has joined us today, and a special thanks to those of you who support our patients in need at Michigan Medicine or plan to. While states are beginning to loosen public health guidelines that were designed to slow the spread of COVID-19, we know that some of our patients are still feeling the negative effects of the pandemic. You can help by supporting the Guest Assistance Program in the Michigan Medicine Department of Social Work. This program helps qualifying patients address non-medical needs that would keep them from maintaining treatment or appointments that would impact their health. As a reminder, a recording of the webinar will be sent in a follow-up email to those of you who registered. Please feel free to share it with a friend or a family member who might be interested. We will not be holding a live event in July, but instead we'll be sending out a video of all our greatest moments. We'll be back at it in August, so stay tuned for more details. Until then, please stay safe, healthy, and have a wonderful summer. Thank you again, and go Blue.